welcome to our last session of the day. I think we can all agree that we've had some very fascinating discussions so far. I think Tolbert said it best when he said we've had beautiful conversations, even despite the grimness of the topic. So congratulations to all of the organizers. I want to make sure that I thank them for having us and thank them for having what I think is a really breakthrough kind of panel at a meeting like this. We're hoping that despite the hour and the great amount of intellectual energy that you've applied already to the discussion so far, we hope you'll bring a lot of energy and curiosity and constructiveness to this final panel. Now, we've heard references and lead-ups to this panel's topic throughout the discussion today. Martin, I think, started us off when he talked about non-pharmaceutical interventions. We're going to be discussing pharmaceutical interventions as we tackle directly the question of how to advance and how to accelerate the research, development, market entry, and appropriate availability of medical products that are capable of combating microbial threats. So we've heard a lot today about incentives, resource allocation, priorities, trade-offs. All of these themes are going to play heavily into the discussion that we'll have right now. I think Carlos spoke the truth when he said today, people are complicated. And I'll borrow that phrase to say that biopharma is complicated, R&D is complicated, and R&D investment is especially complicated. So we'll attempt to elucidate those points and to wrestle with these complexities with an esteemed panel. I couldn't ask for a better panel here today, and we hope you'll engage very interactively with us. In the spirit of deep engagement, we're going to follow Ramanand's lead, leaning into this topic without slides. So what we'll do is to leave ample time for Q&A, we'll have each of the panelists give a brief set of reflections on the topic at hand. We're going to ask them to reflect upon the challenges that they see in view as they pertain to pharma R&D in the microbial threats arena. And in the spirit of, I think, what Martin brought forward today, nearer-term strategies to address some of these challenges, we're going to ask for reflections on possible strategies for overcoming the barriers at hand. So we're actually going to start with my great friend, Paul Schaper, someone I've known for quite a few years. Paul leads global policy efforts at Merck on infectious diseases. He leads leads many things, but among them, he occupies Merck's seat on the board of the AMR Industry Alliance. This is something that we'll hear quite a bit more about in the next few minutes. Paul also sits on the board of the private sector constituency on the board of the Global Fund to Fight AIDS, TB, and malaria. And his purview includes antibiotics, antifungals, HIV, hepatitis, and neuroscience. So a wide scope and deep expertise.